The resurgence of measles in the United States, with cases climbing into the hundreds and deaths already confirmed, is a sobering reminder of how fragile public health victories truly are. Despite having one of the most effective vaccines in the world, measles is back, and it's claiming lives, including children who had no underlying conditions. This should not be happening. The fact that it is happening reflects a dangerous erosion in both vaccination coverage and public understanding of how infectious disease works, an erosion worsened by complacency, misinformation, and misguided policies that place personal belief above community safety. While it's true that vaccinated individuals can, in rare cases, contract measles, this nuance has been twisted to cast doubt on the vaccine's effectiveness. According to the CDC, about 3 out of every 100 people who've received the recommended 2 doses of the MMR vaccine may still get infected if exposed. But this statistic, while technically accurate, does not justify the widespread vaccine skepticism now contributing to real-world outbreaks. These breakthrough infections are usually mild and much less contagious. It is the unvaccinated who are overwhelmingly fueling the spread and paying the ultimate price. Consider the devastating case of the Texas child who died from measles pulmonary failure. This child had no underlying health problems. Their death was entirely preventable. But they weren't vaccinated, and in today's fractured landscape of misinformation, that's becoming increasingly common. Nearly 500 cases have been reported in Texas alone, with the outbreaks spanning 21 states. These aren't isolated incidents. They're direct outcomes of insufficient vaccine coverage and a political climate that increasingly treats science as optional. The measles virus is brutally efficient. It can linger in the air or on surfaces for up to 2 hours. If you're unvaccinated and in the same room as an infected person, your odds of catching the virus are around 90%. That's nearly a guarantee. And once you have it, there's no cure, only supportive care and hope that it doesn't progress into pneumonia, brain swelling, or death. We know exactly how to stop measles. We've done it before. The 2-dose MMR vaccine is 97% effective at preventing infection. That's an extraordinary success rate by any scientific standard. Adults who were properly vaccinated as children don't need boosters. Those born before 1957 are assumed to have natural immunity from exposure before vaccines were widely available. There's no mystery here. No confusión. Just a deeply disturbing refusal, in some pockets of society, to act on what we already know. And the consequences are no longer theoretical. The U.S. had not recorded a pediatric measles death since 2003. This year, there are already 2, and likely more to come. What's even more disturbing is that the conversation is still stuck in this illusion of choice, as if vaccines are simply a personal preference with no societal cost. This delusion, enabled by politicians and media figures who fan the flames of paranoia, is actively endangering public health. It's not just the anti-vaccine crowd to blame. Vaccine exemptions in schools, often granted for religious or philosophical reasons, have created loopholes that endanger everyone, including children too young or medically unable to be vaccinated. In states like Texas, exemption rates are rising and measles is spreading. The math is simple. When vaccine coverage dips below the 95% threshold needed for herd immunity, the virus finds cracks to exploit, and it spreads like wildfire. And it's not just red states or fringe communities. Misinformation travels fast and infects the minds of well-meaning people who are simply confused, overwhelmed, or mistrustful. But it's time for that confusion to end. The science is not ambiguous. Measles is preventable. The vaccine is safe. The risk of not getting vaccinated is not just personal, it's catastrophic. Some may argue that more research is always helpful and that no product is beyond scrutiny. That's fair, but it's not an excuse for inaction. Vaccines are among the most rigorously tested and monitored medical interventions in existence. Any side effects are dwarfed by the danger of the diseases they prevent. Measles isn't some benign childhood rite of passage. It is a deadly virus that kills children, even healthy ones, and disables many more. The question, can you get measles if you're vaccinated, has become a distraction. The real question is, why are we letting a nearly eradicated disease come back to life? The answer is uncomfortable but clear. because we've allowed fear to override science and individualism to override collective responsibility. Until that changes, the outbreaks will continue, and so will the funerals.